Good afternoon, everyone. Welcome. We're waiting for my co-leader to join, and then we'll be ready to go. Thanks for joining us this afternoon. Hope you're inside somewhere cool. She's having a little trouble getting in, so we'll wait. We'll give her one more minute. Don't get too cold there, Marie. What is the temperature outside? Over 100, really? Oh my gosh, haven't been out since 8 a.m. It's a good day to be inside on a Zoom, right? Too humid too. Yep. My hair is telling me that, even though I'm inside. All right. Oops, sorry about that. Testing my slides. I'll give her one more minute and then we're going. I'm waiting for Wendy Anderson, who's the chair of our public policy. There she is. She had another meeting right before this, so I knew it was going to be tight. You on, Wendy?
I'm here.
You made it. Great.
Oh, okay.
All right, we're set to go. Well, thanks for joining us, everybody. My name is Carlin Crow. I'm the public policy manager here at the Iowa DD Council, and my partner in crime and co-host today is Wendy Anderson, who is our public policy committee chair. Wendy, do you want to introduce yourself? I'm not sure we
Yeah,
have you
so
pinned. We
thank you.
probably should pin you.
Yes. So thank you, Wendy Anderson, the Public Policy Chair. I am a family advocate from Trainer, Iowa. I have three children, two of which have disabilities. Thank you all for coming.
Yeah, we're glad to have you here today. We are actually kicking off our kind of period of listening to help put together our public policy priorities for the upcoming legislative session, and also considering, what we might want to look at as Congress convenes next year also, since there's an election coming up, and that means that there'll be new members of the Iowa legislature, Congress, and also leadership of Iowa. So we'll have a new governor. And that could change a lot of things depending upon um, who gets elected. And so we are in a process that I'll explain here in just a minute. But we'll first make sure you know about our listening sessions and how we're reaching out to all of you and getting input. So we have four set up. This is the first one. And so if it's a little bumpy, that's why. Um, we are organizing them by topic, and the topics kind of coincide with the way that we have traditionally set up our public policy priorities. So they're in the topics of community inclusion and healthcare, and this includes Medicaid. I'm sure that'll be part of our discussion for today. The next one is August 3rd, and that's regarding employment. September 21st is special education, and October 5th is voting and civic engagement. So that doesn't mean that we can't talk about those other topics on any of the other calls. We just wanted to um, um, separate them. So if you had to choose one, and we might get different people at the table for who have more expertise in some of these areas if we divide them up. So don't feel like you can't stray off topic a little bit today, because we really just want to get your feedback and your ideas and hear some stories and whatever you want to share. So you can register for the rest of these. You have to register one at a time. And you can do that through our website, which is iowaddcouncil.org. And there's a strip right at the top to register that way. And so, as I mentioned, we are setting up these sessions so we can hear from Iowans, and then we take what we've learned to our council, which is made up as it's our board of volunteers. Wendy is one of them. Wendy chairs the public policy committee. She'll be presenting our um, feedback to the council, and then we'll put together our for what we hear and what sounds like the direction that we should be going. And the council will approve those in November. So we're waiting till after the election to approve our final priorities. And then we start working on them, really right after that. So we're giving us a little time to talk about them and really consider, because there's a lot going on. And that's what we're going to talk about today. So our agenda is we kind of already did talk about the process for determining priorities. We also talk about them at our conference, which is coming up in September. And there we have a couple of days where we have a session where legislators come in and advocates who have had successful advocacy stories talk. And so we get some feedback from them also about what laws or policies they think are important. So if you go to our conference, you'll get a second opportunity to do this in person that time, that way. So that makes it a little more fun to be talking at tables with people instead of through Zoom. So we'll take you through some slides here to talk about our previous priorities and kind of lay of the land before we listen to you. But we really do want to make the most of our time and give time to listen to all of you. We had considered setting up breakout sessions, so we'd have smaller groups, but we have only one ASL interpreter with us, so we're going to stay in one big group for today, and then we'll work on that for the next session. So we'll move on to what our priorities look like usually. So this is kind of the document that we set up, and we're putting it together so it can span the next Iowa General Assembly, which is a 2-year time frame, where we will kind of have the same be working towards the same goals, for lack of a better word, because it really kind of takes 2 years because there's a turnover in the legislature. So once legislators begin to understand disability policy and Medicaid policy, and a lot of it's very complicated. A lot of times things don't happen until they're if they're new, their second year. And when it's a General Assembly, that's typically how they can stretch out some bills too, and get some ideas rolling in the first year and then work on them in the second year. So we'll be putting these priorities together for a 2-year time span. And then if we meet a goal, well, that's all the better. Then we'll have to adjust our priorities. But we usually set them up in those kind of 4 categories, where we talk about the goal of the policy, what particular actions the legislature, the policymakers can take, do some definitions. I know you can't probably see this on your screen, but I can find it on our website if you haven't seen it yet, although I know a lot of you have. And then we tell stories. So thank you for posting it in the chat. And then we have advocate stories on there. And as many of you know, employment was a big area of emphasis in the last couple of years. So we have been working on that category a lot. Um, this time around, though, we're going to talk more about community living, community inclusion, and healthcare today. And so, this kind of when we put these priorities together, it's really to educate legislators um, as much as we can about what this particular what community living means and healthcare to people with disabilities. So our goal is for all Iowans to have the support and healthcare they need to live in the community setting of their choice, and that's a very high level goal, obviously. Then we break it down into what that means. And a lot of it is home and community based services. That's probably not going to change much in the next 2 years. In fact, there might be an increased emphasis on that given what's going on at the federal level. Um, but what kind of plays into that, which could be wages for direct support professionals um, who work for provider agencies that need to provide home care for people so that they can stay in their homes rather than having to use an institution. And then all of the categories of coverage that we can look at to make sure um, people with disabilities in Iowa have the coverage they need. And that could include dental care, which we hear about a lot as still being a problem, and making sure reimbursement rates are what they should be. And all of these, as you all know, are complicated. And usually they usually take money. And that's funding is the hardest thing these days to talk about with policymakers because everybody wants to cut money, cut funding to save money so that we can all pay less taxes, which is a good goal. But to keep services where they are or even make them better, um, an investment in proper funding is something that we usually need to um, convince lawmakers is the way to go. So our kind of calls to action in this area, and we're going to be redefining how we talk about that and talk about it more as a idealist of what legislators could do. Again, looking at reimbursement rates, um, looking at perhaps more tax incentives, the waiver waiting list. I'm kind of going through this dotted list here. Waiver related waiver waiting lists always come up as a topic of discussion because it seems like we're just never going to get them to go away. But really what that means, a lot of lawmakers really don't understand waivers, and then why are there waiting lists? We don't understand why there's waiting lists either, but these are things that we have to. It's all about money, of course. These are all the things that we have to educate folks on. Hopefully, the home project is going to launch on time this fall, and will be the legislature is going to have to look carefully at how that's funded to make sure that HHS can carry out that program as they intend to. Um, Eliminating barriers to diagnosis has been something in the past where a lot of people can't get the care they need because they can't get a diagnosis because they can't get into um, a, um, a provider who can provide that diagnosis. So that's something that we have not solved yet, but we've been gathering ideas how maybe that could we can move that down the line and help with that a little bit more. Um, and increasing providers who accept Medicaid is a huge ordeal, as you all know, especially now with federal funding cuts and what that might look like with Iowa actually receiving less federal dollars for Medicaid. So here we help also on the right define some terminology for legislators or for advocates who do not know what the direct support professionals are and the home project. And, we also try and put in some figures into our priorities. And that's something this year that we're going to be looking at a little more in depth, how we can provide more data. And we will talk to you about that today also. So we also want to talk about, what's happened in the last couple years, and then we'll get to the federal, what's going on federally too. So I know that some of you on here were tracking had and track every year what's going on in the legislature. So I'm sure you've heard about some of this, especially through our materials and our capital chats and newsletters. And I didn't put bill numbers on here, and I don't want to go down into the weeds too much on some of this, although some of these may be things that we need to come back and look at because of um, things that may not be working for one thing as these laws come into effect, but also that are not these these particular issues did not go the way that we like them, so we might be coming back around to them. But one of the big ones is right at the top here was the public assistance bills. There was one in each chamber this year, and they had to do a lot of negotiation and came down to one bill that made a lot of changes in eligibility for SNAP and Medicaid. Actually, more in the SNAP program, and that's probably the one that you heard a lot about. And some of those have actually now had to be reversed because of lawsuits that said we couldn't, or rules changes that said we couldn't be made at the state level because of federal law. So that nevertheless, it's not helping more people get the food assistance they need. It's actually removing people from SNAP. And the Medicaid public assistance eligibility changes also um, were that fewer, or if you became eligible for Medicaid, there was no retroactive eligibility, um, and and work requirements is the big topic that we're worried about there too. There's a lot of other things in that bill, as I said. I'll go over it all again because it's so painful for the most part. But it's a very important one that we need to be looking at. Some good news items that actually came through, though, were accessible prescription labeling for medication for people who are blind or low vision. That was a really great success story that had some great advocacy with it, which we're going to be talking more about at our conference and also in some of our materials. So look for more on that. There was, mental health is an issue and a problem that our lawmakers do want to try and solve. So there was some headway made in people getting treatment that they need, and some service infrastructure changed so that there is more access. It obviously doesn't go as far as most anybody knows that we need. So those were baby steps, but at least it's getting attention. The taxes on HMOs, it was a big issue. You probably heard about it. That actually brought more money into Medicaid to fill a hole. But that's a 1 year fix. And so this will have to come up again next year. And that was a huge fight in the Iowa legislature. One that you all should know about because it's going to be on your ballot this fall is the constitutional amendment for income tax increases. And what it says is that the legislature cannot raise your income taxes, our income tax, any income tax in Iowa, without a 60% majority um, of the legislature. And while that sounds like a good idea because we don't willy-nilly around with income tax increases and let anybody increase their income tax, that clamps some hands for some problems that may need to be fixed in the future if income tax needs to be or something needs to be increased to give the state more revenue. And so it really ties the hands of the legislature, and that affects public assistance programs and particularly Medicaid. So, and along with that, Medicaid seeing a lot of cost containment strategies And that's the big terminology. As we're moving into less federal funding, the state is looking at more cost containment in Medicaid so that anytime we're talking about additional expenditure in that program, it's very difficult to get that moving in a more funding direction. Um, this is an interesting one. There was, more funding for the elderly waiver and also for helping people who are actually in institutional settings move back into assisted living settings. So this is something that, we can look at and say, this is, important to the state and to the legislature in a way that they're a place where they want to save or spend money, because it's obviously saving money somewhere else. So, these kind of where funding did increase in a certain place is something we need to be looking at and thinking about. Is that an idea that we might want to um, look at for how we could consider funding increases? Of course, we needed more IT infrastructure for doing things like tracking people who are now going to have work requirements if they're on public assistance, and that's SNAP and Medicaid. There was actually cuts to public transportation, but then also some other increased funding for institutional care. So that was I know, very a long list and a lot of different things, but some, again, things to think about as we're moving into what direction we should go. And now a couple more lists about what's going on at the federal level. This is something that we really haven't had to do, at least since I've been here at the council, before we start talking about our state legislative agenda, is to start thinking with what's going on at the federal level. But there's so much going on that it seems like we're having to, kind of think about fixing some things that might be coming down from the federal level to the state, rather than kind of fixing what we moving the other direction and in a positive direction, and fixing things that are already a problem here. So at least that's the way we're spending our time these days. Looking at ways that the system could be broken more because of what's coming down at the federal level, and ways that the state is going to have to look at doing things differently. And the biggest one is the first one here, potentially the biggest one, where the Department of Justice has been, they gave an opinion and then clarified it about a week later, and this is in just the last couple weeks, that affects how the Americans with Disabilities Act would be enforced. And it basically says that people with disabilities don't have the right to home and community-based services. And I should clear that as saying don't have the right to federal funding for home and community-based services. You can have home care if you want it, but if you pay for it yourself, if you're needing it through public assistance, then um, the government doesn't think that you have the right to it. It's more what the government thinks is right for you. So this is something that has us all worried about what that could mean in new federal policy, and ways that also we need to look at what's going on in the state and our home and community-based services. And are there things that we could put into policy right now, or talk to legislators about putting into policy that could clarify that, so that home and community-based living is is a priority and not institutional care. And something that kind of backs that up is the Texas versus Kennedy case, which is looking at Section 504. I'm sure you've heard about this too, which, basically a few states got together and said, we don't think Section 504 is constitutional, and wanted to take out the integration mandate. And now most of the states who started in that have dropped out, but the Department of Justice comes out with this integration opinion that would that really basically aligns with what they think these states are saying. So it's very complicated how that's all coming down. So other things I'll go over more quickly. Special education, you've all heard of it's, the Department of Education is potentially closing, or at least dismantling and putting things into other departments. And if a lot of it is a lot of parts of it are going to the Department of Human Health and Human Services, that affects the disability programs in Health and Human Services, um, and could affect community living and healthcare. So that's why this is on this list also. Medicaid work requirements, I mentioned a little bit. There are some tips for states as it comes to Medicaid work requirements. Now, Iowa is moving full force ahead on these work requirements, and the way um, that they have been laid out by the rules of the federal government are very complicated. And so a lot of states are having issues and have actually sued to stop the requirements. But I was moving forward, full force ahead. So there's some ideas for asking the state to perhaps take out some of the or add back in some of the hardship exemptions that they took out so that people who are medically frail, if you have a disability and you're on a social security program that pretty much exempts you, but that doesn't cover everything. And some of those other definitions are requiring a medical definition. And so there's some areas in there that states are having issues with that perhaps we could help them change the definition. Um, Medicaid fraud is something you're hearing a lot about, especially from the state level also. The Supreme Court has had some rulings on voting, the home care labor market, and whether people like parents can be paid to care for people at home. Um, Again, these are all things that are in question at the federal level. The Postal Service and whether we can have mail-in ballots, and also how what is considered getting your ballot in on time. Um, More from the OMB about federal funding through research grants. There's just so much. And budget reconciliation is happening right now because Congress again cannot pass another budget. So that means that we're going to have to deal with level funding or not getting funding increases for a lot of programs. And then, of course, there was the Big Beautiful Bill Act, or HR1, that came into effect a year ago in July. And what we've seen across the country in Medicaid enrollment, especially under expansion plans, is that 5 million people, there are 5 million fewer people on Medicaid or an ACA plan since this time last year. So, makes you wonder, like, are those people getting health care at all now? Because it's, once you lose Medicaid, there's not a lot of direction you can go if you can't afford a private or have access to a private plan or get the services that you need. So, in Iowa, you probably already know we're having services reduced to individuals and hospitals are closing. So, unfortunately, that's a lot to deal with. So I'm going to turn it over to Wendy now, and so we can have our discussion. And she's going to talk us through how we perhaps talk about solving some of these problems that we're dealing with. Wendy,
Yeah,
are you
thanks,
ready?
Carolyn, for such that uplifting news. Um, so yeah, when we think about community inclusion in healthcare, kind of the discussion, or if your brain can kind of think like this, or Carlin can put her email in the email chat too. If you want to think about this the next couple of days while you're trying to stay cool and email this out to us, that would be great as you process through this. So it's really want to come up with the problem. So the problem that we're saying so many people, have is transportation. So transportation is a very large topic, and it's very reasonable, but be more specific. So transportation to medical appointments. Okay, so that's starting to narrow it down. What is the solution? More funding. More funding is always the solution for everything, right? But then when we go to legislators, we're like, well, there's more funding. They would like more funding throughout the state also. And so again, narrowing it down to being more specific. So maybe we could have a license plate that's for disability awareness. And then the funding, the the revenues that are brought in through that would actually go towards um, either a Medicaid program or transportation within Medicaid or something like that. So, and then I know, isn't it a great idea? That's why we keep using it. We're gonna work on this license plate. And then coming up with stories like people who don't drive and need transportation for work or medical appointments. Where are all those stories? Who are those stories that we can uplift and share? And then the facts. So the costs and how costs could be offset with the revenue coming into the state. What we really just can't say is this is a problem and you need to put more money towards it. Um, because that doesn't like that's where when you're talking to legislators, it kind of just gets shut down because it's like, where are we going to get the money from? So, um, okay, you want to go to the so this is where we're gonna, sorry, I was looking at my slides too. So I think, oh yeah, Stacy's story here. So Stacy, fellow from, um, friend of mine from Council Bluffs with her son Alex and sharing his story. And so creating those stories for that. But yeah, now we just want to open it up if I guess if we could raise the hand, either your physical hand or your virtual hand. Carlin, would you mind kind of putting that structure back up there? And if you don't have all the answers, totally fine. We don't expect you to. But I think if we can, really get like what in your minds is some of the largest challenges or problems in community inclusion in healthcare? I mean, I think we could, the Medicaid funding, we're losing services. But does anybody want to work through this system right here or put something in the chat? I'm looking over here. I will call names. No.
Well, I will bring up a problem. I'm not sure how much this is for policy, but the increased denials by MCOs.
Mhm.
So I was curious about when Mandy put that in about lost transportation to work, was it due to waiver services being cut? So I don't know exactly if that fits what you're looking for. It is clearly an issue, but I don't know um,
Yeah.
exactly that's what you're looking for.
Yeah, no, I think that's great because that is a very big challenge in our community is the increase in denials.
Yeah.
What is the solution for that? That's where we can kind of be creative, right?
And
Um,
actually, even though Kelly, we already know this is already an issue, but what, when we're talking about the effects of the one big beautiful bill, now lawmakers are saying, well, give me some specific examples of how what was cut last year is affecting people this year. Because that's an easy way for them to say, I need evidence. Um, and some of those cuts are coming in smaller ways instead of, nobody's saying we're just going to cut out whatever speech therapy. We're just going to, not have speech therapy for anybody. They're just, nibbling away at speech therapy. We've seen that happening already. So anyway, back, it may not be a policy um, solution, but it is something we definitely need stories about. So please encourage people to share those stories.
And Carlin, where are the stories that were collected over the past year? And can we use, I mean, yes, we continually need news stories, but also are there more things to do? So again, that's going to sharing the stories, but so I'm just throwing that out there. So I'm gonna
Yes,
stop talking.
we have we have used a lot of stories in the last year, but we always need new stories, especially if it's a new cuts um, or or rights being taken away, which is uh,
the last I checked, we had a 46-page document of stories.
yeah.
So, Yes. Good, Mandy.
With them cutting for transportation, the people that used to take him to work said it would be either 600 or 800 a month he would need to pay. Well, that really cuts into his disability payment. He works part-time, and I thought it was ridiculous. Granted, it's not very far from me, but that's a budget increase in gas that I was not prepared for. One thing I had to do is look for a vehicle that got better gas mileage. So I'm spending more with a new car, with the insurance, and with the gas than I had originally planned. And of course, now I have to rearrange my schedule and his schedule. So it's very frustrating when they cut things that are necessities almost. And it was just really frustrating to do that. Not that I don't drive him, but when you've had it for so long and all of a sudden it disappears, it just kind of throws everything off.
Yes,
Was
thank
that
you.
transportation to work? I'm sorry,
Yes,
Mandy.
to work, but between work and home, because of the distance we live to where he does Special Olympics and other things with Goodwill, we couldn't get that transportation, so we had to provide it.
Yeah, so a great example of how, I mean, we all know this, but to break it up, transportation to medical appointments, transportation to work, those are all barriers of entry and points of a lack of funding and community inclusion.
If if the license plate went through, I know quite a few people that would jump on that.
Yes, yeah. It's on the top of the list, well, of the Wendy list, not necessarily the priority list, but yeah, what else? What are the challenges for community inclusion that any of you on here are facing? You don't have to go through the whole process. We can just keep listing things. I don't know how to do a poll, or I would make a poll. If I had candy, I'd give you candy. Lack of programming closer to home. Driving 30 minutes to engage in activities. Lack of childcare. What about medical childcare? Anybody challenged by medical medical daycare is what I have around. I have people with challenge around that around me.
Evan has his hand up.
Oh,
Go ahead,
thanks,
Evan.
Evan.
Well, hi. Thanks for doing this. Um, is the home project changing the waivers to the age thing to make them so they're like young person, adult instead of brain injury,
Yes,
HCBS?
yes, that's the plan.
Because wouldn't that kind of balance the transportation out? Because right now they do like different things like the brain injury does rides, non-medical rides, but the other one, the HCBS does like um meals. And it's like they do different things. And so for non-medical rides for the brain injury waiver, it's it's a little more access to the community than the other one only gets a limited amount of non-medical rides. And I think if you even them out, I don't understand why they're different. I think if you shared the access to non-medical rides, I think there's a lot of, um, well, for I have a power wheelchair and I know there's some business that um, providers that would like business that could be out in the community taking folks to like work or other non-medical things um, that would be access for individuals and to see individuals in the community from just a society that I think would be good. Because I can relate to, I get rides to work and my mom's retired, but it would also just throw, it would just, sorry to ramble on, but I relate to the previous, was it Mandy? Because you might be able to provide a ride, but it's just nice having a ride from a service provider.
Mhm.
It's
Yeah,
makes me feel independent. So
thank you. Thank you, Evan. And yeah, from the meetings that I've been on, the whole redesign was designed to give people the services that they need. So hopefully, as this rolls out, that's what we'll see. So yeah, good. Thank you. As I was kind of looking at the things again, I think we've touched on low wages for direct support workers. The newsflash, there's still a worker shortage, and we are able to pay them more, potentially that could be a solution to it. Um, and that goes right along with the reimbursement rates, right? That agencies or providers are seeing. Um, I don't think there's been an increase in dental care providers. Is anybody seeing that, or are we still having a dental care shortage? I know they were trying to right size some of the fees, and hopefully that will help. But as we know, this can take time with that. So, shortage and a very long wait times. Yeah. Um, I'm also concerned about, the clinics that are closing. Myself living in a rural area, I think about outside of the major cities, will there be a decrease in access to healthcare with those facilities closing? So, yeah. Any other thoughts? I know there's been stuff flying through the chat. I haven't had a chance to be able to catch that, but yes, Stephen.
Hello. Let's see. There we go.
Well, we can
Hi.
see that you're on the beach.
Yeah. Yeah, the beach in Clinton, Iowa. So very realistic. Um, I am first of all, I appreciate the dedication and work of the council here. I'm brand new to this. This is my first meeting. So but I wanted to see the reason I came is I wanted to see if I could connect with anybody who might be working on the So Everybody Can Move initiative, which is uh, an effort to get states to adopt some rules to require insurance providers to cover prosthetics for um, various kind of life activities for amputees. I'm a recent below the knee amputee, and so I'm just kind of new to learning about all of this. But like the short version of it is that if you have decent insurance, you're likely covered for a prosthetic that covers like normal daily kind of use. But if you have any desire to do any kind of active lifestyle things like running or swimming or other things like that, oftentimes the prosthetic that you get is not, you can't use it for those other activities without violating the warranty on the one that you have. So um, the So Anybody Can Move initiative is working state by state to get states to adopt some model legislation to require insurance providers to cover a second prosthetic for activities that go outside of like the normal daily activity. So I understand that there's maybe some people who are already working on it in Iowa. I know that IPAPA's got some work on it, but I haven't been able to connect with them yet. So I wanted to see if anybody here knew anything about it yet. I don't know if it's appropriate for that to be a priority for the council or not, but I thought maybe I'd connect with somebody.
Yeah, thank you, Stephen, for
Thank
bringing
you.
that to attention. Yeah, have not heard about that, so I might get back in touch with you.
I'll put the link to the nationwide campaign in the chat.
Thank you.
That'd be great. Thank you. Yeah,
Thanks for joining us.
I don't know of anyone, but yeah.
And Evan's
Good,
hand up
Evan.
again.
Hi, I'm back. I think it's important. I think absentee ballots have been upheld, but for me, my place of voting is away from the bus route, and in November it'd be scary to try to get there. So for me, absentee ballots are important. I don't know if that's a thing.
Yes, thank you. That's important to hear.
Yeah, I was like, oh, it's another great point on the absentee ballots. Thank you.
Yeah.
What else? If I started saying anyone, I might age myself. So um yeah, we will have a session on voting too. Evan, oh wait, Evan, maybe your hand's still just up. It's shown. There you go. Good.
Yeah, I'll be at the voting meeting
Awesome.
as well. Thank you
Yeah,
both.
just anyone else, what do you think the priorities should be? Or sometimes I like to think about it of if this went away in my life, how would that impact? Or in my son's life or in our family's life. So again, you're more than welcome to put it in the chat or to email Carlin also with that if you aren't able to talk today, but I just want to have it open. And
I'm here again.
Awesome.
Sometimes I have stories and it's like, this is going well for me. Story. Is that I mean, is that an okay thing? It's not like this is because like my ride to work on is going well.
Yeah.
And so I want to keep it. So it's a little different. A lot of my stories in the past have been this is something that is not good. But then sometimes I want to say this is something that's good right now. Can we keep it sort of story? Is that an okay
Absolutely.
angle or
It's good, Evan. In fact, what we need to kind of dig deeper in your story and say this is, a way that we can think about using data and a story, your personal story together and say, because I'm able to work and because I have transportation, I am able to contribute this to my community, or to the state, or because I have these things, I don't have to use these other programs that cost money. And I'm thinking the way that lawmakers think. These are the kind of stories that, if you've got a success story, how is your success? If we could replicate your success, what would that mean for other people in the state from I hate to say it, but a cost benefit um, way of looking at things is the way people are driven these days. So we got to kind of think of telling more stories that way too. So Thank you for
think
sharing.
I think that occurs sometimes with my peers sometimes too. If something doesn't come up, if something's not, sticking out, if things are like, how are things going? Well, things are going okay right now. Well, then maybe do a highlight of a service right now or something.
Right. Good idea.
Thank you.
Thank you.
Caregivers need to be paid more though.
They sure do. And we need
Yes.
more of them.
Yep.
Yes. Anybody, I'm curious, anybody have any creative ideas or ways of thinking of things like we thought of the license plate? Has anybody else thought of any unique funding or have seen a different state do ways to get funding? No. It is a hard one to come up with ways to increase um, funding or to combat the lack of funding. So, yeah. Well, Carlin, I know we're getting closer to time here.
Yeah, I'm taking notes of what's in the chat. So thanks for sharing things in the chat.
Mhm.
Sounds like David is looking at transition. And David, are you meaning transition from high school to work or community?
Yeah.
Usually transition service. Wendy, you might talk about transition services.
Ooh, like well, we have the 4+ services that are after the school. So that's kind of a transition after high school into that transition service. And then there's also the transition to the adulthood. So the transition with the 4+ services, we'll probably talk a lot about that too on our special education call. We'll bring that issue up with there also. And that is another thing on the waiver, with the waiver redesign and watching for that, where the transition to adulthood waiver doesn't really overlap with the transition for the schools. So um, there can be some interesting things going on there as we see more come out. So yeah.
And David, if you have a child in school and you're just wondering when transition starts, if nobody has said anything or started talking about it by ninth grade, then reach out to your school and ask them to start talking about it.
Yes. Um, housing is that I mean, as we were talking about transition to living, um, I think housing is a huge component of the community inclusion. Um, the available housing, the income and asset limits, like again, it all goes into that. The lack of affordable housing can be a challenge.
It looks like Mandy likes the license plate idea, so we're going to put you to work on that one with us, Mandy.
Yeah. It was an idea. It's been done in other states, so
I think it's awesome. I work with a couple nonprofits to do other things, but this one just clicks. And with all the options you get to have a personalized plate, this one would be one that I think people who, family members, friends, knowing that it would help with different things would jump at the opportunity.
Yeah.
thank you.
We need a really cool design. Somebody needs to come up with a really cool design to suggest.
Yes.
that
Yeah,
everybody
that's the thing.
um
Need for more mutual support communities for people who don't need group homes, but who do
yep.
need more support. Yep. Than living in a normal neighborhood or apartment building. Yeah. The pie in the sky. These are all things that we're gonna put out there. So okay, great. Well, again, you can close or I can, but thank you everyone for joining us. And Carlin, would you mind sticking your email in there again? It got buried a little bit, but
Yeah. And people have been emailing me already with stories and ideas, so I appreciate
perfect.
that, and just keep it up. Um, we will uh, we will reach out if you got a really good story, um, and then feel free to, consider coming to some of our events where you could tell your story also. And if you think about ideas, yeah, really let us know, because hopefully this helped get your juices flowing a little bit. And you know, a lot of the times, like we went over all the things that happened last year and what's happened at the federal level, and we feel like we're just constantly responding to all these new things are coming, and we need to like get in front of it and start thinking more about how do we prevent getting in this position where we're constantly having to um, look back and fix things that are getting broken over again. So being more forward thinking, and also looking at things that are going well for you that we could talk about, that are good investments, because if we need to invest more in those things that are going well, lawmakers need to hear about that too. So thanks everybody. We really appreciate your participation, and look forward to seeing you again at one of our events, or hopefully you can come to the Capitol this year and tell your story too. Love that. So keep in touch. Hopefully you can get on another session. Have a good rest of the week, and try and stay cool. Good night.